first of all, just to tell you where this interest comes in for me is that my husband went to dental school and he's an orthodontist, and then 20 years ago, so for 20 years I've just really been interested in dentistry and nutrition, and currently I work at Stillwater Medical Group, so see lots of different populations there, but always very interested in how nutrition and dentistry come together. So I'm excited to be here today to talk to you all about the world of nutrition in dentistry. And so first of all, I just want to start with a question or two. How many of you in the audience, with a show of hands, have either had conversations with patients or have had a patient in your office or your setting where you're thinking, boy, if this patient can eat a little bit healthier, I bet that they would do better? So show of hands if anybody has ever experienced actually having conversations with patients or just, boy, I really think I'd like to. So some of you guys, yeah. So how many of you are interested in nutrition for yourself or for your loved ones or your family? Okay, so hopefully today you'll learn a lot, not only for your patients, but also for yourselves and for your family too. So a little bit more about this dental connection and nutrition. The reason why nutrition is important in dentistry is because it helps improve your patient's overall health and also just helps them in better healing as well. There seems to be a movement in your industry to treat the patient as a whole person. So thinking about all kinds of health things when you're thinking about the patient. The most important thing, though, that I think for you as health professionals is that many of you have very unique relationships with your patients. The frequency that you see your patients sometimes is more than what the patients see their doctor. So sometimes you all have this opportunity to do some screening. Also, you can identify kids and adults who are at risk for malnutrition, maybe because you're seeing their immune system not working right or things aren't healing, that sort of thing. So I think that this unique relationship that you have with your patients is really an important piece. So I'm glad that you're all here today and going to learn more about nutrition and how that can work for your patients. So what I'm going to talk about today, I'm going to talk about optimal nutrition for the dental patient specifically, and then I'm really going to get into diabetes care and prevention because that's a big one. How many of you see diabetes patients in your settings? Yep, very common. We're going to talk about healthy weight because everybody's very interested in that, and it's helpful for individuals to try to get to a healthy weight. We'll talk about that pediatric population. Touch on some health trends for 2018 that I'm seeing. And then also, lastly, we'll end with what your role is as a health professional in actually encouraging these patients to eat better. So let's talk a little bit about dental populations that you see in relationship to nutrition. In periodontal disease, you might be seeing patients who have diabetes, obesity, or malnutrition. So we're going to dig in there. You might see an elderly population who have issues with poor healing, different chronic diseases like diabetes or heart disease or high blood pressure. You may see malnutrition in these patients. How many of you see children? Okay, so with kids, of course, we see cavities, but you might see malnutrition or growth issues showing up. Obesity in kids is on the rise. Self-esteem, you guys can role model for some of these kids that are coming in with some self-esteem stuff related to what their weight is. So we'll talk about that today too. So let's get started with this inflammation link. When they look at patients who have cardiovascular disease, diabetes, that's that DM, insulin resistance, or having smoking history, obesity in their diagnosis, what they're finding is they're finding some inflammation markers in these patients as well. So there is this inflammation link. In diabetes, periodontal disease is significantly higher in those with poor glucose control. So important for those patients, if they're not having good glucose control, to figure out how to get better glucose control. And then in obesity, those with periodontal disease, it's 76% higher in patients who have obesity in their diagnosis. So a big player there as well. And then also inflammation might show up with those patients with malnutrition, nutrition deficiencies, compromise immune function, so nutrition's involved there as well. So the goals of optimal nutrition for your dental population include, treating that whole person, that philosophy of, let's just be we're health professionals, let's encourage just good, healthy nutrition and movement with our patients. But also zeroing in on how do you eat to decrease inflammation. So we'll talk about that. How do these patients improve glucose, reduce obesity? Those are very important. How to enhance immune function, promote healing, and protect against infection. So we're going to dig into those a little bit deeper today. Let's start with seniors or elderly patient population. Probably the biggest thing with this population are those older patients who have a lot of tooth loss or tooth pain, and they're just not able to consume things like meats or proteins, fruits and vegetables, those kinds of things. And so a lot of times we might see protein calorie malnutrition in these patients, not only because they're eating less, but also because they're just not getting the protein sources in. Can anybody think of other reasons why they might not get protein for an older individual? Financial hardship, yep. Just lack of taste for it as you get older sometimes with some of those medications too. So vitamin A, vitamin C, if they're not getting the fruits and veggies, can be a deficiency. A lot of these individuals have other health things going on, cardiovascular disease, maybe immobility is an issue as well with these people. Some other things that might show up there. The biggest thing that I see, because I do work with this population a little bit, is the social isolation. And it just might be because they're not driving as much. Maybe their spouse has passed on, friends have passed on. And so that can affect how they eat. Think about eating. It's a social thing. So if they don't really feel like eating alone or making a meal for just one person, they may just skip that meal. Why? I'm just not feeling hungry, no one to really eat with. Maybe you're their main social contact for the week. So keep that in mind too, because there's a place for you there too to also make a personal relationship connection with that kind of individual as well. Depression can really be a part of this too sometimes. Depression biochemically goes hand in hand with some of the diseases that the elderly population has. Patients who have had stroke, there's a biological link there of depression a lot of the time. So not only just some of the environmental things that may be, encouraging this, a person maybe be depressed, also just some biological things can play in as well. So optimal nutrition for seniors has to do with getting enough calcium, getting enough calories and protein, nutrition in general for that patient. So just to kind of give you an example how you maybe could do this with a patient in your chair. Maybe Millie comes in and it's in the morning and, a question that you could ask, maybe she's not healing well, or you're just kind of wondering about her because her spouse just passed away. Something you could ask, you could say, you could come right out and say, Millie, how do you think your nutrition is? And she might say, oh, it's fine. And then you might say, well, did you eat breakfast this morning? And she might say, no, I didn't have time. Okay, that could be a flag, but maybe not. Maybe she really didn't have time. Then you could say, well, how many meals do you usually eat in a day? That could be a red flag right there, because she could say, well, 1 or 2, depends on if my son stops by, or, so that would be an easy way just to kind of have a conversation with Millie about, getting an idea with, is there a nutrition concern here? Another great thing to ask older individuals is say, how often do you have protein in a day? And a lot of times they might say, no, not at all. I don't have any on hand, I don't like it. So that just can start the conversation a little bit. If you're seeing patients like this a lot, you're going to want to have collaboration with maybe an area clinic where you can get some resources for some basic information. Where if Millie obviously is having some eating issues, you could give her a handout, something from the American Dietetic Association, or maybe your clinic nearby might have some good basic handouts for older clients like that, so that she can walk out with something. If you don't have anything on hand, one thing you could do for older adults is encourage milk. Not that I'm, milk is a fine, great thing, but not that I'm totally promoting milk. But if you think of an elderly person, it's an easy thing. You know, it's not as expensive, easy to drink something, then chew something sometimes. When you're not hungry, easy to drink something. The thing about milk is there's some protein in it, and there's some, you know, carbohydrates. It's kind of a balanced, you know, it's not a magic food. I'm not saying dairy is a magic food or anything like that, but for an older person, it could be something that you could quickly cover some bases with as that person is leaving your office, especially if you don't have a specific handout for them. Let's see, also, you know, those supplemental beverages like Ensure and Boost, if you end up having a lot of these patients in your office, you could go to the website and request some coupons from any of these big websites. And then you can have some of those coupons on hand to hand out to patients that you think would benefit from a supplement like that. Some of these antioxidants that come from fruits and veggies, they may need to be encouraged to keep canned fruits and vegetables on hand. So if there's a sodium issue with them for health reasons, maybe then they're rinsing those canned vegetables. Or if there's a sugar issue with, you know, some of these patients, maybe then they would rinse off those canned, but they're a lot softer. So it's an option for them to get some nutrients from those canned kinds of items. Otherwise, maybe some supplementation if they're really not healing and there is a poor immune function happening with that patient. So dry mouth, that's another thing that comes up. So having handouts on that for patients might be good. Making sure that they're getting enough to drink, maybe some lemon in their water. Making sure they're not eating too much salt, because the other thing with an elderly patient is they may be relying on boxed processed foods to use in a microwave if they're unable to use a stove. So lots of different things with an elderly patient. So if you're seeing this population and you don't have educational materials for that, you'll want to collaborate and have those on hand. Like I said, you could be the person that they're seeing pretty regularly and for a lengthy amount of time. Sometimes you're seeing them a lot longer than they might visit with their own doctor, right? You might have them in your chair in the office area or in the waiting room and getting to know them. So let's talk a little bit about diabetes. This is a biggie because diabetes is on the rise. I would say that probably 50% of our country has some sort of blood sugar abnormality, you know, an issue with glucose regulation. So first what I'm going to do is I'm going to talk a little bit about how the body uses glucose, and then we'll go from there. So this is an example of a cell. Let's see if I can get this pointer to work here. Ooh, yeah. Okay, so this is a cell right here, that yellowish goldy blob. And each of these white pieces right here is glucose. So what happens when we eat food, especially carbohydrates, and we'll talk about that in more detail, turns into glucose in the bloodstream. So that's what these white things are. The key is representing insulin. So our pancreas makes insulin. And what that insulin does is it opens up the door, unlocks the door into the cell so the glucose can go into the cell. So let's picture my neighbor next door. He's 16, he plays basketball, he's very fit, doesn't have any family history of diabetes in his family. He goes and he has a big sub, maybe a Mountain Dew, some chips, an apple, some healthy, some not so healthy. And he eats all this food. What happens is his blood sugars go up, as it should, and right away his own insulin brings that glucose down, just like that, nice and perfectly. And so that's probably what happens to a lot of the population. But like I said, there's probably 50% of the population where it doesn't work so slick. As we get older, there's issues. As we gain weight, there's issues. Family history, there's a lot of different risk factors for diabetes. But what can happen for some of us is when we eat that same meal that my healthy neighbor ate, our blood sugars can go up. And then what happens is maybe we don't have enough insulin to bring the blood sugar back down to where we need it to go. Or maybe we have enough insulin keys, but maybe the key doesn't fit. The key is bent, it's broken, it just isn't doing the trick to open up the cell. So people who have a blood sugar abnormality or diabetes or pre-diabetes, what happens there is either their insulin, the key, they don't have enough of it to really move the sugar into the cells, or they have this insulin resistance where they've got keys, but the keys aren't sensitive anymore. They don't fit, they really don't unlock the door anymore very well. And so I'll talk about what affects that insulin resistance, kind of what brings it on. But that's sort of what happens in the body when we talk about sugar. So when we talk about prediabetes, what is prediabetes? That's where your glucose or your sugar level in your bloodstream is a little bit higher, but not high enough for a diabetes diagnosis. And so look at this statistic here. This 1 in 3 adults has prediabetes. So that's not diabetes, but that's 1 in 3 has prediabetes. Then there's diabetes on top of that as well. So it's very prevalent, very common. And we're diagnosing it better, which is good. But part of it is people are gaining more weight, people are not as active. There's a lot of different things that I'll touch on. Actually, it's right down there. So these are risk factors that bring about insulin resistance. Overeating, eating too much carbohydrate, so there's way too much sugar for our own insulin to deal with, that after a while, our insulin just says, oh, I can't keep up with that Mountain Dew and Sub and chips anymore for this person. And so then this kind of just, that insulin doesn't do as good of a job. Weight gain, inactivity increases insulin resistance. And, you know, just think, we're moving a lot less with all these conveniences that we have. We don't even have to go grocery shopping if we don't want to. We can just order it up. And now Amazon, we can order anything we don't have to go outside. Has anybody seen that WALL-E movie? Very depressing. It's where they don't move much and then they just sit and they do everything virtual reality. So hopefully we won't go that direction. Okay, so the other thing that's interesting is stress brings on insulin resistance. So there's, you know, cortisol that our body releases when we're under a lot of stress, and that makes our insulin not work as well either. So controlling stressors is very important. I would say that's a trend. I think that we're catching on that, boy, our mental health is linked to how our bodies react. Ooh, that was loud. And then also our sleep. So if we get poor sleep, our bodies can overproduce hormones that make us hungry. And so sleep is also very important when it comes down to insulin resistance as well. So if we want to prevent diabetes, be careful not to overeat, especially those carbs. And I'll get into more detail with that. Avoid weight gain, move more, control your stress, and sleep 7 to 9 hours a night. Okay, that helps prevent diabetes. So here's those carbohydrate foods that I was telling you about. And a lot of people have a real good knowledge of carbohydrates. It's very trendy to know about carbohydrates. But these are the foods that when you eat them, when you digest them, they change into blood sugar in your bloodstream. So they're things like bread, rice, pasta, crackers, cereals, fruits, juices, milk, sweets and treats, those kinds of things. Those are the foods when you eat them, you digest them, they change into blood sugar. So the goal with a diabetes patient or pre-diabetes patient or somebody with a blood sugar abnormality is to limit those high sugar foods. Spread those carbohydrates throughout the day so that you're eating an amount that your body can handle at each sitting. Avoid liquid sugar sources, so that's like, you know, regular pop, juice, Gatorade, those kinds of things. Encourage the whole fruit instead, for example. Include fiber and protein at every meal. That's also very important. That fiber helps calm the rise in blood sugar, so if you can get patients eating more fiber kinds of things from fruits and vegetables, that's helpful. More whole grains in their breads. Avoid skipping meals. The interesting thing about skipping meals is that your liver will make sugar if it thinks that you need it. So if you go 8 hours without food, your liver's going to get in the way, dump out a bunch of sugar, and you end up with a high blood sugar anyway, and then maybe an overdump of insulin anyway. So that's why eating every 4 to 5 hours is a better way to really help with blood sugar management. Daily activity helps insulin resistance, helps your insulin work better. And then the biggest thing probably for a patient who has diabetes is to learn about carbohydrate counting. You know, what are carbohydrate foods? how much can I eat at each setting? That's what you really want to learn about when you have diabetes, is spreading those carbohydrates out and then knowing, well, what is a portion? What does that look like? So I'm going to show you this plate right here. Here is an example of a balanced plate. So on this plate, we've got some carbohydrates. So remember I said there's milk there, there's a potato, so that's a carbohydrate, and then there's some fruit. And so there's 3 carbohydrate servings or portions on that plate. So that's a nice balanced plate. Usually we encourage people to have 2 to 4 at each meal. If they're more active and they're younger, then they'll need more, and vice versa. Well, no, not vice. Usually 2 at least as a minimum at each meal is what we recommend. The other great thing about this plate before you is that half the plate are vegetables. So remember I said fiber helps calm that rise in blood sugar? That fiber right there is going to be helpful for blood sugar as a result. Plus, there's no carbohydrates really that are going to raise the blood sugar from those veggies. Then it gives you something else to do too, because it takes a little while to eat those veggies. The protein there, this is meat in that corner there. That doesn't raise blood sugars, and so it's something else to eat. It's something else to satisfy our hunger cravings. So it's good to include protein and fiber at each meal with a reasonable amount of carbohydrate. So that's what a balanced plate looks like. I'll bring this plate up again as we move along, because we're going to talk about healthy weight. And interestingly, what you'll see is a lot of the things that I talked about already go hand in hand with weight management, similar recommendations as people who have diabetes or pre-diabetes. So first of all, what do the studies say? So a couple of years ago, I went to the American Dietetic Association had a course that I took, and then I went out and I did the testing and the live course in California. And what we did beforehand, and then while we were out there, is we looked at 44,000 or so studies and analyzed them, found out, well, what really works with weight loss anyway? And what we found were these 4 bullets. Is that those who eat breakfast burn 5% more calories. And so that was an important thing for weight management. Also important was this personalized balance of carbohydrates, protein, and saturated fat, a calorie deficit. But not only just the calories, but also that the carbohydrates are, like I had just mentioned, spread out reasonable. So we have a good blood sugar thing going on. And then also protein at each meal. And then saturated fats, that those were in moderation. The other thing that the studies found loud and clear were some kind of monitoring for people. And that's where we're seeing all of this technology and apps popping up. Have you guys heard of MyFitnessPal, Lose It, what else? The Fitbits, all those kinds of things. So those are kind of self-monitoring, keeping you accountable. So those were things that were really beneficial too. Now when I did this a couple years ago, the craze was not quite there as much. So when they were talking about journaling here, even just writing stuff down or emailing a coach or going to a class and kind of having interaction or coaching experience that encouraged journaling and feedback, that also was proving to be successful too. Exercise, what the studies talked about that is that yes, exercise is helpful. More so in the part of maintaining. So the good news about that is if you have a patient who's not very mobile, they can still do a lot of good and manage their weight by diet. I would say diet for the older population, I would say diet for my age and up is an 80% player. The fitness piece is a 20% player. If you're younger than 40, I'm older than 40, but if you're younger than 40, then probably exercise is more of a player. You can do more toning and that sort of stuff, but really moving the weight for someone who's overweight, they can do a lot with diet alone, which is good news. But the thing about exercise, just me with working with exercise, I also have a degree in counseling psychology, is that the greatest piece of exercise is that there is a pretty big link to mental health and the good mood chemicals with exercise and moving around. And people are going to eat better when they are psychologically feeling better too. So there's a lot of other benefits to exercise besides just shedding pounds. So I'm a huge fan of exercise. If there's insulin resistance or anything with diabetes, then exercise needs to be a player. Then it's more important because we need that insulin resistance to be helped. So that's what the study said. Then what I do with my patients that I work with at the clinic and the weight loss classes that I teach is I take that a little bit of a step farther. And this is the checklist that I do with them. So it piggybacks off what the research says. And not skipping meals, eating every 4 hours, breakfast is a must. That balanced plate that I just showed you, the veggies and the protein source and whole grains for fiber, avoiding excess carbohydrates, choosing more of the healthier carbohydrates, and then limiting saturated fat. So we'll talk about that a little bit next slide. But this is why that balance piece is so important. Protein is staying power, fiber for feeling of fullness and that glucose control. Making sure that you get all the vitamins and minerals that you need to change food into energy. So some of these diets that are very restrictive are not doing us any favors because we need those nutrients to kind of give us the energy and to really make our bodies do what we want them to do. So what if you say, gosh, Jennifer, I do not feel like having vegetables for breakfast, or I don't really have any meat on hand. How can I eat balanced? I just don't feel like having those two things, so this is what I teach people to do, is that you want to maximize then your carbohydrates that you're buying in the grocery store, that on the label they have protein and fiber in them. And then that changes the composition of your plate a little bit so that when you don't have as much protein on hand or you're not eating as much protein on hand, or if you don't have as much veggies or you're not really feeling like vegetable at breakfast, you can choose a cereal that has protein and fiber in it, paired up with an apple, and then you have a nice balance. So to just show you an example, here's an example of a label. So if you look at that label, what I encourage people to do is see if there's protein and fiber on that label and compare back to back. If you're going to choose two different cereals, which one has a better balance? So the way that you analyze balance is by looking for protein and fiber on the label. So this label right here has 11 grams of fiber and 13 grams of protein. So that's very high in both of those categories. So that's a good product. That's going to be nice and balanced for that person. It's going to help calm that rise in blood sugar. It's going to help satisfy the person's hunger. And so that would be a good choice. That little, that first sentence there that says, when you're choosing carbohydrates in your grocery shopping, you're looking at the label. Try to find carbohydrates that have 5 grams of protein and fiber together. It's not a magic number. It's just that I'm a grocery shopper. I have kids. I have 3 boys who help me grocery shop. They're all middle school, younger high school. And so I have them help me shop for balance. And so the reason why I pick 5 is I know that there's enough products out there that have 5. Of course, there's some that have way more, just like that one. But this one's workable. It's real life. There are a lot of products that have 0 protein and fiber when it comes to carbohydrates. So, potato chips, probably 1 gram of protein, or barely. So instead, what you can do, these are just Triscuits. So I look at the label. There's 3 grams of protein and 3 grams of fiber. So that's 6 altogether. That would be a good product. Special K. So let's do that one. So this one has 6 grams of protein and 0 grams of fiber. So 6 together. So that's a good product. Where Cheerios, that's not a bad cereal. It's got a little bit of protein and fiber, but maybe it just has 3 grams of protein and 1 gram of fiber. Just 4. Chex, that just has 2 grams of protein and 1 gram of fiber. So there's just 3. It's very low calorie too. So there's other benefits. That's not a bad cereal. But if you're looking to make your breakfast more satisfying, then you're going to want to find more protein and fiber. If I eat this for breakfast, I'm going to be full until probably noon. just because that protein and fiber helps fill me up, calms the rise in blood sugar, so I'm not craving sugar an hour or two later. Where if I had Fruit Loops, I'd be craving, more sugar an hour later. So that's what you do, is you sort of grocery shop, so you fill your pantry with carbohydrates that have protein and fiber in them, and then your plate becomes more balanced without even thinking about it. Of course, when you can get fruits and vegetables, that's better. So these right here, these are like a bean lentil chip. So this compared to your potato chips, this one's got 4 grams of protein and 3 grams of fiber, so 7 total together. So great product. They taste pretty good too. So there's a lot of different products. Once you start looking, kind of knowing that trick, you're going to be surprised how you can find things to really balance out your plate. One more thing. So this does not come in your cereal boxes. But okay, so white bread. Had to transport it somehow. So, the white bread, this is just 3 grams of protein plus fiber. I looked it up before I came on my packaging. And so if I made a sandwich, that would just be 6 grams of protein and fiber. So I'm not going to be real satisfied. I mean, there's a little something there, but I would be way more satisfied, and I am when I eat this bread. So this has got 6 grams of protein and fiber per slice. So together, 8, right? I wrote it down. Let's see. Yeah, 8 grams of protein and fiber per slice. So together, I've got 16 grams of protein and fiber in this bread. Plus, I'm going to add, some stuff in between, some veggie and some. So this is very satisfying. I'm super full when I eat a sandwich with this bread. And so there's lots of different, with breads, there's just so many to choose from. You don't have to choose the most fibrous one or the most high in protein. It's just sort of comparing back to back different brands and coming up with a good compromise where your taste buds go, yeah, I can like that, and it's got some good nutrition too. Okay, so a little bit about saturated fats. We're going to talk about that next, but when you look at labels, foods that are considered low in saturated fats are less than 3 grams on that label. So this one has 0, so that one fits the bill there. So a little bit more about saturated fats. I've got this divided into 3 different groupings here. So we've got the saturated fat list, polyunsaturated fats, and monounsaturated fats. And so what I encourage people to do is on that saturated fat list, if you're eating a lot of foods from that section, you might just want to take a tabulation a day or two and see where you're at. Ideally, the American Heart Association recommends 10% of calories from saturated fats. Also, when I was mentioning about what the studies say in weight management, those that ate less saturated fat compared to those that ate a lot, had more belly fat through the middle. So by limiting saturated fat, that is more helpful for weight management. The other thing about limiting saturated fat is that, look at the list of some of these things. If you're eating a lot of stuff with butter and cheese, you might be eating donuts, you might be eating fried and breaded foods, you might be eating at Burger King, so there might be, it's not just a saturated fat thing, but it's also a calorie thing too. But if you think, gosh, I do eat kind of a lot of things from this list, then you might want to do some tabulating, and then ideally that 10% ends up being about 10 to 15 grams of saturated fat per day. So to put that into perspective, I love Hershey bars. So there's 7 grams of saturated fat in a Hershey bar. So I can either eat that Hershey bar and say, hey, I love it. It's going to be part of my 10 to 15 for the day, and that's all good. Or I can say, I guess I don't like it that much, plus I'm having a few other things. I eat a lot of other things, so I'm going to pass on that. So it's kind of, putting into perspective of how it fits into your full day's worth or your week's worth, for example. If you're looking at that list saying, gosh, I don't really eat much of anything from that list because I'm pretty healthy, I don't eat a lot of fried and breaded foods, I don't eat donuts, then you might say, well, gosh, that's probably not an issue for me. I'm probably pretty moderate then in saturated fats. The highlighted foods that are there, those are the foods that provide with omega-3s. And I could probably talk another hour on that. I'm a fan of omega-3 fatty acid sources. There's a real good link with reduction in inflammation just by increasing omega-3s. So those are highlighted there for you. Other sources that aren't listed there would be like flax and chia. Those are kind of trending right now, I would say. So that's that saturated fat list. Other tools that can work for weight management beyond some of the diet, nutrition kinds of things are getting active, building muscle, stress reduction, improving your sleep, just to kind of tame some of those hormones that are linked to appetite, and cortisol that's linked to holding fat through the center. Assess your emotional eating. Mindfulness is a nice trending thing right now. People reading books about how to eat mindfully. I'm working a lot with patients with that. Getting support from classes, dietitian, a friend, a family, taking a cooking class, reading a book. Those are all great ways that can motivate us to eat healthier. Journaling, coaching. I believe that a problem well defined is half solved when it comes to the way that we eat. So if you're not really sure where you are, or if patients aren't really sure if they're eating well or not, journaling can really tell a person a lot. That's where people can come up with aha moments, like, wow, I didn't realize that caramel frappuccino is 750 calories and 160 grams of sugar. I didn't realize that, but I wrote it down and now I had to look it up and there it is, staring at you. So those are aha moments where, oh, okay, I'm not going to get that every day anymore. And then people can have a paradigm shift sometimes when those aha moments come about. Let's see, journaling can be really anything. It can be journaling on paper or any of those electronic mechanisms that I mentioned earlier. It's just something that keeps you accountable. So let's talk a little bit now about the pediatric and adolescent population. First, I'll just go through a few trends that I thought were pretty interesting. So 25% of teens drink 2 to 3 cans of pop a day. 15% of preschoolers drink 3/4 to 1 can of pop a day. 46% of kiddos consume no fruit 4 days in a row. This is nationally. Kids eat 7 refined grain servings per day, so that's processed, but only 0.9 whole grains per day. 40% of kids don't have any whole grains. So those are some of the statistics that we're dealing with. I think that this is starting to improve, though. I think especially in Minnesota, this is improving a little bit. So good education and things like that. So what is optimal nutrition for kids? Healthy weight is important for these kids. And I'm going to go into details with each of these bullets. But discouraging the restrictive eating, negative body image. If you have relationships with some of your patients where you can just keep an eye out for that, that's good. Smart snacks and foods for a healthy smile. Limiting sugar and sometimes limiting those additives for some kids is helpful. Adequate calcium sources, adequate iron sources and vitamin C to help with that iron absorption. And just encouraging overall balanced diet, just like what we talked about. So balance doesn't really sell books, but it really is kind of the way to go. I mean, it's really what I believe strongly, and my colleagues do as well too, is just this concept of balance. So what do you do as adults with kids in your life? If you're a mentor or a parent or you're seeing them in the office, how can you mentor and help kids towards a healthy weight? It's kind of a delicate situation, I feel. The first thing that I encourage people to do is when we talk to kids about a healthy weight is encouraging activity first, having them get moving, limiting screen time so that they are, oh, I don't know what else to do, so I guess I'll just go outside. I mean, that's what I have to do with my boys, is the only way I can get them outside is if there's nothing else on the screen happening. The other thing is that it really does start at the grocery store, so parents have a powerful role in this. It really does start with what they bring into the home with what the kids are choosing. You know, if they're buying chips and Fruit Loops and all this pop and the kids are drinking several cans of pop per day, that's something that the parents can swoop in and make a change instead of having the child feel like, oh, I gotta restrict myself here because of my weight. No, the parents just could maybe shop a little bit differently. As a parent or mentor, you can avoid fast food restaurants, avoid those fried and breaded. And that's okay to talk to kids about fried and breaded. It's not good for their body. They won't feel good if they eat like that. Encourage breakfast every day. I think statistically, I gotta see, I think I wrote down breakfast, I'll find that statistic, but there are quite a few kids that are not even, 42% of high school students are not eating breakfast. Partly because school is starting so early, they're just racing out the door. But that's where having something quick on the go for them to grab. Breakfast is where they get a lot of their iron, and I'll talk about that in a minute. So if we're missing that, it's not good for kiddos. Be a good role model. I like the idea of family goals versus individual goals. When I work with families, if you see there's a child in the family who maybe is a little bit overweight, I'd rather see that whole family get on board and eat 5 fruits and vegetables a day instead of just the one child having to do something different. I like the whole family to get in on it together, and then no one's singled out. I had one patient who the mom had a separate cupboard for her daughter. It's like, no, we're not going to do that. The healthy food in her cupboard and all the junk in the pantry for the rest of the family. So, also good sleep habits helps with weight management for kids. So media out of the room at night helps them sleep better. Focusing on health versus the scale with kids, also a good way to go about it. I always use caution when we're thinking about positive body image. I use caution with some of these concepts. So I don't focus on calories or fat grams with kids. I might have mom or dad grocery shopping for low saturated foods in the grocery store, but I'm not having the kids really look at grams of fat or calories. Instead, I have them like what I taught you. They're looking for balance. Is there protein and fiber in the foods that they're choosing so that their body will feel better? Weight scales, kind of downplay those. Dieting references or trendy words. A lot of moms are dieting, and then the kids are hearing those dieting words going on too. So if those could kind of be on the down low in front of kids, that's better. Sometimes girls are concerned about their tummies. They're still just growing tall, and so their tummies are going to, as they grow, their tummies are going to stretch out. So that's another thing that sometimes girls are a little bit concerned about. The other thing are the kinds of magazines that you have in your waiting room. Just take a glance at them and ask yourself, are they promoting negative feelings for the girls that are coming through, or are they promoting, strong mind, strong heart? That's a better kind of magazine to have in your office if there's those types of magazines instead of, all the body image stuff. You know what I mean? A lot of them out there. Let's see. Sometimes if there's a hyper-focus or control over food with special diets or gluten-free, or sometimes those are very necessary, but sometimes it can create a lot of stress for kids, having to be so restrictive compared to their classmates. So delicate with that as well. And then as I mentioned, some healthy strategies for the family member are better left behind the scenes. So the child doesn't really know exactly what's happening, but boy, our family's eating healthier, but they don't really realize why or what's being restricted. It's just kind of working out that way. So a little bit about restrictive diets and the dangers of it. So eating disorder diagnosis is 5% in high school girls, and so those are just the diagnosis. So there's a lot of girls that still have some eating issues that aren't really diagnosed. Other dangers of restrictive dieting might be slow growth, being irritable, definitely, not able to focus in school, depression, limiting carbohydrates excessively can really, carbohydrates are serotonin boost, and so if you're limiting carbohydrates excessively, there's a risk then for decreased serotonin levels. So smart snacking, all of you know a lot about this already, but just a little slide on that. Limiting the between meal snacking, of course, is important. Eating every 4 to 5 hours, choosing the non-stick sweets, cutting back on those sugars. Adequate calcium sources. A lot of kids are choosing pop over calcium over milk. I'd rather see a kid drink chocolate milk than pop, for sure. And then these are those lists of high potential for decay, medium potential for decay, low potential, no potential, and then the cheese, nuts, and milk that may actually inhibit the decay. Okay, so, I was just going to show you this. Let's see. This is just a list of sugar in different pots and things like that, and then the acidity level as well. So are these clocks right in the back? I don't think they are.
The right one is, the left one is.
This one's not, but this one is, so it's 2:45. Okay, good. Okay, so a little bit about calcium, because calcium is important for building strong teeth and bones and protecting against osteoporosis. As I mentioned, people are drinking less milk, and so getting less calcium in their diet. Only 14% of girls and 36% of boys are getting the RDA of calcium per day. These are just some different calcium sources and serving sizes that make up about 300 milligrams. And then this next slide tells you, breaking it down into age groups, what's required. So you can kind of figure out, well, how many servings then does the patient who is 10 need? You can kind of look it up that way. Vitamin D is a nutrient that's getting a lot of coverage, I think, not only because it helps absorb calcium, but also helps with mood regulation. And so getting vitamin D in your multivitamin is a good practice, but also vitamin D sources from these food sources, beneficial. And sun exposure, so some of us in Minnesota, it definitely ends up being beneficial to have a multivitamin with vitamin D in it. Iron, that's another important nutrient for kids. And like I said, kids that are skipping breakfast are at higher risk because a lot of our iron sources come from fortified breads, fortified cereals. And if they're going to school without breakfast with an iron deficiency going on, hard to focus for kids. So these are those iron sources. And vitamin C helps iron absorb, and so pairing up those sources alongside these vitamin C sources is really beneficial. So now I'm going to talk about the health trends of 2018, as I've seen, and a little bit right now as well. The first thing that I want to tell you is there's a little bit of an unhealthy trend going on because of we're moving less. I mean, how many of you know people who have a job where they sit behind a computer all day long and they get up maybe once or twice? That's kind of what we've got going on here. And then in school, kids are sitting down all day and then they're coming home, and the statistics say that in high school, kids are spending 3 hours a day after school doing leisure computers. So, social media on the phone or computers, but social, not school related. So they're not only sitting all day in school, but they're coming home and they're sitting for 3 hours on video games or whatever it is too. So kids are moving a lot less. There's less exercising as a result. And then also, I think overall, we have unmanaged stress levels and just busier lifestyle. Things seems a little bit more complicated, I think. That's kind of my opinion. So I just put up here the dietary guidelines from 2010 to 2015, and then I'm going to compare them to the new dietary guidelines. They haven't changed a lot, except for the new dietary guidelines are a little bit more detailed, more specific. So we still think all of these things are still good. More whole grains, more fruits and veggies, calcium, make wise dietary fat choices. So in the new guidelines, we're more specific. What does that mean? Getting calcium, lean proteins, limiting the sugar and salt. So those have stayed the same, really. It's just that these are a little bit more detailed, where we're talking about, well, how many fruits and vegetables? Okay, let's go for 5 at least. And then 10% of calories from added sugar, 10% of calories from the saturated fat. It gives you details on, well, what are we really saying about sodium? 2,300 milligrams, that's about a teaspoon. Alcohol, if consumed in moderation. So these are the new dietary guidelines. So they're not a lot different. I feel like they're just a little bit more specific. Other trends that I see, would be people want to eat for more energy. I have a lot of clients who, I'm so tired, how can I feel better? Protein and fiber at every meal, spread out those carbohydrates. Good mood from food, less processed foods. People flash around the idea of cleaner eating, anti-inflammatory diet or the Mediterranean diet, mindful eating techniques, and then strategies using the technology. So those are the trending things that I see popular right now. And then these are just ideas, well, how do you eat for more energy? Normalizing blood sugars and hormone levels really helps for a person who's feeling, gosh, I'm really feeling a lot of fatigue. Making sure that they're eating enough vitamins and minerals, protein at every meal, timing of every meal, eating every 3 to 5 hours to avoid those dips or the blood sugars dropping down. Some of these nutrients that I've listed down here are important, either getting them through food, sometimes supplementation. Doctors are checking these levels if unexplained fatigue is popping up for people. And so that's a trend, a good trend. I think that we're keeping an eye on those levels. Good mood from food. Some of the things that we've already talked about, but really eating balanced. Iron sources, omega-3 fatty acids from fish, whole grains, vitamin D foods, folate, B6, B12. Anybody know what vitamin X is? Nobody ever does. Exercise. So that also helps. Like I said, helps with serotonin levels for sure. So clean eating, let's talk a little bit about that. I'm going to tell you what I define as healthy clean eating because there's a lot of different, this isn't really a standardized term out there at all in my world. But I think that clean eating is really just eating foods in their most natural, unprocessed state. So emphasis is on lean meats, fruits, vegetables, whole grains, dairy, nuts, seeds, oils in their natural state. So ideas to really make this eating clean idea happen might involve shopping locally at the farmers markets, reading ingredient lists so that there is little processing going on as possible. So some of the questions to ask yourself when you're reading a label or a list would be, can I pronounce these words? How long is that list? Some of the words that might be listed might actually be a vitamin added or some sort of fortification, so those are okay, like iron and folate. Is sugar in the top 3 ingredients? Sugar has been connected to inflammation, so if you've got ingredients that have sucrose or glucose or high fructose corn syrup, those might be products to limit. Watching the labels for saturated fat, limiting trans fat. And then I just have a slide on there for you about some kinds of chemicals that are in foods that I think it's kind of a continuum because some of the chemicals in food really help food have a good shelf life. And so those are not, but then there are some that, boy, we just don't have a ton of research on them. And so maybe these are some of those that are, well, let's use caution with these. I always tell people too that come to me and they're wondering about a gluten sensitivity, because that's pretty trendy right now as well. I always tell them, why don't you cut out some of the processed stuff, the donuts, the food coloring, some of these things first before you completely cut out gluten and see how you feel. And so I'll have people start there, because sometimes people who think that they have a gluten sensitivity really are just reacting to some of these additives. So I have them do that first before cutting out a whole entire food group. And then here's just a little bit of a guideline for choosing organic. I think that what this list kind of lets you know is that there are 12 fruits and vegetables that more often than not might have a little bit of pesticide residue. Still safe amount, otherwise we wouldn't be able to sell them. But for someone who wants to take it a step further and be more, maybe they're doing everything else that's nice and healthy and now I want to dabble in doing some organic foods, then this might be a good place to start. Maybe you'll still buy the Clean 15 regular, whatever's best on sale, but maybe the Dirty Dozen, you'll start buying some that are organic. Another thing that a person could do if they want to move more towards organic could be choosing, grass-fed meats, free-range eggs, for example. what else? The milk that's a little bit more antibiotic and hormone-free. So this is an example of a Mediterranean diet. This is what a lot of the physicians are talking about when we're talking about reducing inflammation. To really break this down, this is what it looks like. So it's, fresh, plant-based kinds of foods, minimally processed, getting some low-fat cheese and yogurt for the calcium, for the probiotics, fish, poultry, weekly, eggs. With eggs, I'm a huge fan of eggs. The Mediterranean diet encourages not going overboard with them, but I feel like there are plenty of brands out there that don't have very much saturated fat anymore. I don't know if they're making eggs differently or what, but sometimes an egg has 3 grams of saturated fat in that yolk part, and sometimes it has 0.5. Just depends on the brand. It depends, it just really depends. So I'm a huge fan of eggs because there's so much good in an egg. And cholesterol in an egg doesn't make your body make cholesterol. It's too much saturated fat makes our body make cholesterol. So when we talked about saturated fat earlier, if you're limiting saturated fat in other parts of your diet, there's definitely room for eggs. More olive oil, regular activity, moderate consumption of wine, or none. Okay, so I want to talk a little bit about, end with just how you as a health professional can take this, to the next level. So remember, you have that unique relationship with patients, and that's the biggie right there that I think is important. You're able to screen patients, identify kids and adults at risk because of your relationship. And so what do you do moving forward? Well, first of all, keep educating yourself on nutrition, because if you've got someone in your chair, they're going to look to you as a health professional, and they might have a question for you. And to be able to answer those questions because you're the one that they're having contact with is really great. It's a great opportunity for you. So stay educated about good nutrition. Involve your whole family or your whole office in making changes. So if you are in an office setting, it's really encouraging if you're working with coworkers who are also trying to be healthy. So you can kind of model that for your coworkers. Let's see, assessment tools in the waiting area. So, questionnaires about nutrition, some literature about nutrition in the waiting area would be good. Staff training, office brochures are a way to learn more about nutrition. National Nutrition Month is in March, and so if you go to the American Dietetic Association, they have lots of posters and fun stuff like that for the offices. And then refer higher risk patients out. Those higher risk patients, I'm going to tell you who they are so that you know. Diabetes patients who have not seen a dietitian for more than a year. So insurance coverage for people who have diabetes allows them to have 2 hours of education every year. Sometimes patients don't know that, and it's covered. And so just a check-in. And so usually what that involves is if I work in a diabetes education center with nurses, so we see the patients together, which is really nice because then the nurse can make medicine changes. I can talk about the diet. But if you have patients in your office that have kind of slipped through the cracks and they have not had education in a long time, and you're kind of noticing that they're frustrated with what their weight is doing, or maybe they're just not healing well, or they have more periodontal stuff going on. Maybe it's a blood sugar thing, and so encouraging them, hey, go, see if you can get in with your dietitian or doctor and get those blood sugars under control. You can ask them what their blood sugars are, and if they're saying numbers like 200, 150, you might say, yeah, let's get in there. Or if they say, oh, I'm just borderline. So my old instructor used to say, there's no such thing as borderline pregnant, there's no such thing as borderline diabetes. They might think borderline is, I have diabetes, but I don't take medicine. That's still an issue. I have diabetes, but I only take medicine, I don't take insulin. Still an issue. They still need to be diligent because diabetes can progress quickly. So that would be a red flag if they say they have borderline. It means they haven't had full education if they think that. Patients who are obese or have heart disease, or maybe they have had unsuccessful weight loss and they're just voicing their frustrations with you. Encourage them to see a dietitian or a nutritionist, or take a class, a community class. It can be nice and economical for patients. Kids with obesity or restricting eating behaviors, have them go, I see patients, sometimes kids are more receptive if they're gonna go to a sports dietitian instead of a dietitian, or a coach, go to a coach who has a nutrition degree, or, because then it's not so much about dieting, but it's more about, I wanna eat healthy to be strong for my sport. Sometimes that gets kids in the door better than it's a scary dietitian word. Malnourished patients, seniors that you're sort of screening, if you see them, have them talk with somebody. Or even just if you have patients who, gosh, this person is just really not responding well, I think there's a nutrition thing going on with them. Also, it didn't show up here, but patients who have a lot of diarrhea or IBS or something else going on GI-wise, send them to us as well, because there's probably a pretty big nutrient deficiency that's coming up. It will come up for them if it hasn't already. So those are those high-risk patients. This last slide in here, I know it's kind of small on your handout, but this might be fun for each of you to just take and see where you fall. This is just a little quiz that I've used in some of the dental offices I've worked with over the years, where it's just a simple, little score. Sometimes people like to take little quizzes while they're waiting. And you answer all those questions, and then the score tells you if you're doing great nutritionally, or if there's a moderate risk, or 7 or more would mean a higher risk. And then maybe they'd want to go visit with somebody. So I'll leave that up there because it's kind of small to see. So questions for me? Yeah.